is Carly Robinson, and I was fortunate enough to take the International Health course with Dr. Paul. I believe it was last fall at this point. And during that semester, she had charged us with picking a project that really spoke to us, that had an international health focus, and building a solution or a plan to address that issue. And so one of the things that I was really interested in was this idea of refugee health. And this spoke to me for a couple of reasons. First, I had known somebody that worked with a local organization that helped place refugees. And so she gave me some insight into that experience, and that was really helpful for me. And the second thing was that it was immediate and impactful, and I didn't have to think of it in abstract terms. I could actually build something that could be used immediately. And so this was the presentation that I put together. The mission statement of my project was to improve the health of incoming refugees to Jacksonville by providing a tool that housed key health information that could be accessed by either refugees or their caseworkers that really helped them access the sometimes complicated world of our healthcare system. And this was going to ideally improve the health of the overall Jacksonville community by reducing healthcare costs in the area. And the way that I envisioned that working was if we could just help refugees understand when to go to a clinic versus when to go to the ER for simple things like the flu, then we could impact the healthcare costs in the region that way. So to give some context on this issue, Jacksonville has been a hub for refugee resettlement for many years. There are 3 major organizations here that are doing work towards that end. So that would be World Relief, Catholic Charities, and Lutheran Services. World Relief is the organization that I partnered with, and I actually spent some time in their offices prior to putting this together to gauge a sense of what they needed and what I could do that would best impact their needs. They resettle refugees constantly, and with the crisis in Syria, that is only going to be a bigger need for them. So what I wanted to do was build what I call JAX Refugee Health, and it was the first online database of its kind, or I wanted it to be, that had information specific to refugee health and their specific needs, which varies from the rest of the population and also varies refugee to refugee depending on their situation or their country of origin. So the needs assessment. When I sat down with the people at World Relief, they said, we really wish we had an online tool that we could use for healthcare. They handed me literally stacks of binders covering a wide variety of health topics in a wide variety of languages. And it was just printouts. And it had paper stuffed in the corners and CDs attached to it. And they were like, I don't even know what this is. It was just cumbersome. It was not a tool that they could use real time. And it wasn't something that they could easily update as healthcare changes, which changes constantly, especially with the implementation of Obamacare. And so to go back to these binders, reprint out all that information, reprint it in all of the various languages that it's needed in, it wasn't feasible. And they weren't able to actually use them. So there are 2 breakdowns here for this online tool. There are the needs for the caseworker to have a tool that's comprehensive, easily updated, and can be used for a variety of clients that can also be easily translatable with the push of a button as opposed to printing out pages and pages of information. And then for the refugee, they need information specific to our healthcare system in Jacksonville. So where are the clinics? How do I get there? What do I bring when I get there? And what kind of facility do I access for my needs? So for my target population, I was specifically targeting the refugees in Jacksonville. There are roughly 27,000 refugees resettled in Florida every year. And so the tool was targeted towards those that happen to come through Jacksonville, and it would address prenatal care, dental care, family care, emergency care, OBGYN, and it would be used when refugees are immediately resettled and also in that period after they're resettled. And that's a good distinction to make because when a refugee first comes through the door at World Relief or any resettlement agency, I think they get 90 days of case management, where they're rushing to try to get them set up with housing and maybe a job and health care and child care, and all of these things have to happen in 90 days, and then, in theory, the tie is severed. World Relief is really focused on managing them after the fact, and so this tool would be used not only to set them up with their initial healthcare needs, but also for those healthcare needs that are ongoing in nature. So the goals for this project was for each caseworker in Jacksonville to have one resource that they can access that would allow them to easily provide the needed information, update that information without a labor-intensive process, and easily translate that information with the push of a button. And then for every incoming refugee in Jacksonville, I wanted them to be able to know or identify a local physician in their area that accepts Medicaid, and that's key because that is the financial funding that they receive when they arrive to the United States. The appropriate level of care, so when to go to a clinic versus when to go to an ER, what to bring to a doctor's visit, how to access translation services if that's needed, and how to plan a route using our local public transportation system. So this is a snapshot of that actual program intervention, and it's a website called JAX Health. I set it up as a blog for a couple of reasons. First, it was just the only resource that I had immediate access to during the time of the semester. And also, it is easily updated. They have options where you can enable it for a mobile device very easily. And they have, well, I thought maybe they have translation services. I'm not sure, but anyway, the real-time updates, the fact that it's free and doesn't cost anybody anything to run this was really attractive to me. Long-term, I envision this being more of a real powerhouse of information. So it would be on a server. World Relief would own it. They would update it. It would be exactly what they needed for their needs. I envisioned even like a string of flags at the top representing different countries, and you can press it and it would translate all the information into the language of that country. So something with a lot of power behind it, but we're just not there yet. And then if that were to be successful, you could even, I envisioned this being something that other refugee organizations could use across the country and could even access information to their specific area. You know, maybe you have a map of the United States and you click that region and suddenly you have, you know, the different health needs of that region specific to your refugee population. A good example of that is in my intervention, I had information about hurricanes and how do you deal with hurricane preparation. That's very specific to Florida. Refugees would need to know that in the event of a disaster of that magnitude. Maybe not so in Ohio. So I'm going to go ahead and pull that up. So we'll take a minute in the presentation.
Yep. Okay, so we'll cut here.
I'm trying to think how best this would work. Because it's controlled from here. So
do you want me to
move through it?
You can.
Yeah. If you just want to.
Yeah.
See, I don't know how many of these links actually work anymore.
Okay.
Because it's been. Let's see. It was all working like.
I know.
Once upon a time, you know. See. I haven't been keeping it updated or anything. I don't think any of these work.
You know what we can do? How about this? How about we finish the presentation?
Mm-hmm.
Is it hard to link them up? Would you just go to the transportation website, copy the link? Because we could splice it in. Because I'm going to film Wednesday too. We could just do the internet stuff where we just show how to manipulate the internet.
Well, you know what I could do is if you're going to film again on Wednesday, between now and Wednesday, I could just fix all of this and then come back and present this piece if you'd like.
Sure. Do you mind doing that?
No, not at all. I'll wear the same outfit.
Yeah, that would be great.
because that way we don't have to like struggle with it right now, and then I can get them all running, and we'll just
That's perfect.
come back and do this.
I forgot you write the links because it changes so frequently.
I know. See, and that's why it needs to have a staff. That
Well, that's a good reason for it.
So we'll just
So why don't we say cut and we'll splice in the website walkthrough
on Wednesday.
on Wednesday. Yeah.
Okay.
We have the guys ready to go, so I can do a bunch of editing.
Oh, let me go ahead and put the presentation back.
Oh, yeah. You can say, as you can see, whatever.
Right.
Great so far.
Okay, so we'll allow some time, and then we'll cut.
And I'll say, begin. Okay.
Begin. So this was a timeline that I put together and something that you'll be doing. And the way that I wanted this to work was we would implement this tool over the course of 24 months. And so it works in a schedule like this. So month 1 to 4, you'd have technical scoping and development of the first version of JAX Refugee Health. And then month 5 through 6, you'd have the organization and execution of focus groups that consisted not only of refugees but also caseworkers. Get them in the room, let them play with that first version that we built, and get their feedback. Does this work for them? What do we need to add? What do we need to take away? And then months 7 through 8, we would do a version 2 that incorporated that feedback, and we would do real-world case studies after version 2 using that version as they helped refugees in real scenarios. And we would keep doing that cycle of those stages all the way until month 24. So ultimately, by month 24, we would be developing our 5th version of JAX Refugee Health that incorporated all of these real-world case studies that we had done in addition to these focus groups as well. And this is just that monitoring and evaluation that I spoke about, the 5 versions over 24 months. And then so for a total period of 6 months divided throughout the project timeline, the project team would update the information as needed with the feedback that we received. And so you'd have, I think, 4 ease-of-use focus groups built into that timeline. This is an example of the budget. This, I think, was almost the most challenging piece, and I remember in class, we all sort of like, how much money do we plan for some of these projects? I think that this even changed by the time I finished it. I budgeted, let me put that down. I think I budgeted almost $75,000 to $85,000 to get this off of the ground. And that included my budget, another person that would help me, a consultant that would come and help us build the website, write code for the website, equipment if we needed our own computers or what have you, the actual domain usage if we were to buy a domain, research, and just other expenses, other minutiae that we built into that. Ideally, what we wanted to do was to ensure that when we did this, when we were done at the end of 24 months, we would have budgeted dollars built into World Relief's budget itself to continue to operate this. Because in order for this tool to remain valid, somebody has to be on top of it. Because like I said before, it's always changing, and the caseworkers themselves are overloaded. They cannot be the ones that own this. So we budgeted specific people to own it, and that would be continued after the 24 months. Just so that those resources, those dedicated resources, could be leveraged instead of just dumping it on the caseworkers. And then once again, you have something that's not up to date, not accurate, not usable. So that is my experience. I included a slide here for my contact information. And I guess in summary, what I would say is when you do this project, really push yourself. Do something that's a little bit outside of your comfort zone. Maybe something that you have no connection with, just to expand your horizons, because I presented this to World Relief. I actually got up in front of their directors, and there was a refugee, an actual refugee that was helping them with casework that was there. He provided feedback that was really great. It was just a wonderful experience. And through the course of this project and through that semester, I completely changed my career goals, as a result of this project. And so I was a journalism student as an undergrad when I did this. Now I'm a graduate student doing epidemiology with the goal of trying to do something with an international health focus and maybe work for the WHO. So don't be afraid, go in, full force. You can really put together something that's impressive that you can put on a resume, and that can lead to future possibilities. Thank you so much. So now I want to show you my actual website that I built for Refugee Health. And just bear in mind as I show you some of these things, this is just a very simplistic working prototype of the larger project that I envisioned. So I'll sort of walk you through that. I just built this on WordPress because obviously with limited access to resources for this project, it was free and simple and easy to do. So I called this JAX Refugee Health.wordpress.com. You can actually go there if you'd like. But at the top here, we have our mission statement with just a brief summary and some bullet points on what you might find on the website. And then I tried to include some infographics. This one is about the Zika virus, which is very relevant right now. And it has some information. And when I presented this to my peers, they really encouraged more infographics because, refugees are pre-literate or illiterate or speak different languages. And so having as much info presented in this format as possible was, they thought, more helpful. So I have some here about Zika, symptoms and where it comes from, and so forth. And then I have some about hurricane safety, which is very pertinent for our area. I have some down here about healthy pregnancy, vitamins, food you should take, things like that. There's one here about dental health. There's one here about healthy eating. I have some text here about 9 things to bring to your doctor's appointment, which I thought was really helpful information for an incoming refugee. My peers thought this was a little too text heavy, especially in English, English language. But the good thing about WordPress is that you can change the actual language of the text content of the website with a push of a button. So this actual text, because I typed it myself, I could have that translated into any language. So it could still be very helpful. All about that. And then an infographic about when to go to the ER as opposed to, just a walk-in clinic. And then some more text, too, that could be translatable. Because that's a big thing for refugees to be able to understand is, how do I go to just a walk-in clinic versus the ER? The first instinct for refugees, and frankly, for Americans, is to treat all illness through the emergency room, especially if you have limited insurance or no insurance. So I think conveying the difference there is really helpful. And then on the menu bar here, I tried to include some helpful links to outside services. So the first one here is local translation services. And this is actually a company in Jacksonville that does face-to-face translation that you can schedule. And then we have one here for transportation information that has bus schedules. There's another one that includes the all the routes that are all mapped out with all the bus stations. This one was really cool. JTA actually has videos that show you how to ride a bus, how to flag a bus down, how to get a prepaid card for bus fare if you need one. I had a link here for transportation fare, how much money you need to have, or if you want to load a prepaid card, how much that would cost. And then There's a list here of OBGYNs and midwives that accept Medicaid. And then you can click on any of these names of practitioners to be able to get more information and schedule an appointment. I have another link here to the Magnolia Project, which provides health services for women and babies and for families. And that's a Northeast Florida organization as well. And then there's a list here of some primary care physicians in the area with their address, where you could
book. Who also take Medicaid.
Who also take Medicaid, correct. Yeah. Mm-hmm. And then dental services. This is another local company, also accepts Medicaid. And then I provided just a link down here also to World Relief's own blog, and they have a lot of good information. Some here about Ebola and events that they're doing. So I thought it was good to sort of circle back and have a little plug for them as well. And the reason that I included a little more links, I provided a couple of different means of access to family and child care, because when I presented this to World Relief, there was actually a refugee in the meeting who said that family health, especially for young mothers and children, is so important to the refugee community. He thought it was their most important issue. So I tried to bone up the amount of information that I had about, where to get those services and how to schedule those appointments. So again, very, very simplistic. I would envision this to be a lot more fleshed out, a lot more interactive, a lot more easily translatable if we would actually build this and have it work the way that it was supposed to. But this just sort of gives you a working idea of how I envisioned this tool working, the types of information that would be included, and this would be used for refugees and also for their service workers, their caseworkers. So pertinent information for them as well as their caseworkers.
And this is a great project because you can easily obtain funding for this. It's a great project that someone can fund, either the state or a private organization, because it's tangible, translatable, relevant to a number of different target audiences, and easily updatable.
Yeah, that was the key. Easily updatable, because everything that World Relief has now is not easily updatable. And so they specifically asked for something with that type of value add. And like you said, what I really love about this is the idea that this could be picked up by other organizations across the country and adapted for their specific communities. Like I have stuff in here about hurricane prevention that could be different for other areas, or maybe they're more prone to other disease, whatever their level of need is, they can adapt this idea.
Fabulous. Great. Thank you so much, Carly. I appreciate you spending time and sharing this with everyone.
Absolutely.
It's fantastic.